Hello, I'm Dr. Marla Shapiro, and I am pleased to sit on the Board of Trustees of the International Menopause Society. And today I'm joined by Dr. Susan Goldstein from the University of Toronto, who's a primary care physician and has developed a really helpful approach to menopause. We often call it a simple approach to menopause, but there's nothing simple about menopause. And for women who are often confused by headlines and by anecdotes from their friends, this can really be overwhelming. So tell us about what you've developed and how this can really help a woman understand this period of time in her life.
So I've developed a tool. It's called the MQ6, which is the Menopause Quick Six. The reason it's called that is because it's quick to do. We know that there are knowledge gaps in primary care and other clinical settings. And so I tried to create a tool that would make the asking of the important questions for patients simple, quick, and it's written in lay language because there are these other assessment tools out there, but they're often written with a lot of medicalese, and I think that's difficult for patients. It's also written with open-ended questions because we hope that if your clinician takes the 2 minutes to ask you those 6 questions, it will be the opportunity to facilitate a discussion and open up a discussion about your menopause, and in particular, some symptoms that you might not feel comfortable talking about.
Or might not necessarily know are related to menopause. So walk us through what those 6 questions are, because I think for a woman who is even anticipating going to see a healthcare practitioner about menopause, that doing this before you see your practitioner helps you create, if you will, a to-do list of what to talk about. So what are the 6 questions?
So the first question has to do with your reproductive stage. So have there been any changes to your periods? Early on, as we know, early premenopause, perimenopause, the periods may get closer together, then they may go further apart, then they may have stopped. And that's a way to let your healthcare provider know where you are in terms of your menopause journey. It's also an important question because a lot of women don't realize that if you stopped having periods for a year or more, and then all of a sudden your period comes back, that's actually not normal. And that could be a signal of something that may not be okay and it needs to be investigated. So I'm glad that that piece will trigger our consumers, our women, to know that, oh, I better go talk to my physician or healthcare provider about that. The second question asks about what we call vasomotor symptoms, which are you having any hot flashes or night sweats? The third and fourth questions relate to something called the genitourinary syndrome in menopause. And we've had lots in the media over the last number of years about menopause. It used to be called VVA, but really what the GSM is, the effects on your tissues kind of below the waist that occur as your estrogen levels drop after menopause. So they can affect the vagina and they also can affect the bladder and surrounding tissues. So the third question is, are you having any vaginal dryness? It's very common, 50+% of women are going to have that. Are you having a vaginal pain or pain with intercourse? Also very common. The fourth question is, are you having any issues with your bladder or incontinence? It's amazing how many women think it's a bit of a rite of passage that, oh, I'm getting older and now I'm going to have trouble holding my urine. And I don't need to tell my clinician about that. There's nothing to do. And that's just not true.
Or
Fifth
also
question.
that question about vaginal dryness often happens into well-established menopause where women think, oh, this is just aging and don't see the link with no estrogen and having these symptoms. So that's a very important question anywhere along the continuum, even after your hot flashes and night sweats may have gone away.
Absolutely. So we ask about these GSM symptoms, and then we ask, how's your sleep? Because we know that sleep disturbance is huge around menopause, and often just a change in sleep can be an early signal that things are changing. And it's not always related to hot flashes. I think sometimes our patients think, oh, it's because I have hot flashes. And if it's not the hot flashes, then the sleep thing is not related to menopause. So we need to ask about that and explore it. And then the last question is how's your mood? Because in fact, particularly in the perimenopause, so those months and weeks before final menstrual period and for the few months after that, we know that's a very high risk time. It's almost like a window of vulnerability we talk about, where women can in fact develop irritability, anxiety, new depressive symptoms in someone who's never had depression before, or recurrences of major depressive episodes in patients who previously had depressions.
Right. So really important because again, you may not associate mood has anything to do with estrogen. So this is really important for women because if anything, it opens up that world of questions that you can put on your list. Well, yeah, this bothers me, this doesn't, this bothers me, and then have a really, directed conversation with your healthcare practitioner.
Absolutely. And that's the intent of the tool. It's not, for the physician or healthcare provider to assess you, but it's also written for patients so they can self-administer the questionnaire and then take it to their doctor. It's a good way to start the conversation going.
So, aside from the questions, which I think are really helpful to broaden out the conversation when you see your healthcare practitioner about the symptoms, is there anything in terms of resources, information, education where a woman may say, "Oh, I didn't know this about dryness, and I want to know a little bit more."
Absolutely. So I'm very excited to say that with the support of the Canadian Menopause Society, we have taken the MQ6 tool and we have built a website to support both healthcare providers, but also to support women. And the tool is on the website, but it's not the only thing there. We've got lots of information about hormone therapy, about menopause, how to go and speak to your healthcare provider. There are resources with links all over the world, including to IMS, because these videos, are really helpful for patients. So there is supporting information for them as well.
Okay, so if you are a woman and you are in midlife or transition or wherever you are, but interested in how hormones interact, particularly in the transition and then postmenopause, where do we go?
mq6.ca, menopausequick6.ca.
So mq6.ca, and it's really written in language that's easy to understand. It helps you really focus on the symptoms, some more knowledge, because an educated woman who goes to see her practitioner is going to get so much more out of that visit, and also may find some difficult topics like sexuality, difficult, painful intercourse, topics that may be difficult to talk about.
Absolutely. And we hope that the website will provide some resources and information, and that the tool itself might help bridge the gap for patients that have difficulty or are uncertain about what to talk to their healthcare providers about.
Well, thank you so much for joining us. That's mq6.ca. We're all going to take a look.
Thanks very much.